Okay. Girl, welcome to Smart Nursing, our first ever live stream. Please give me a thumbs up if you can hear me. Trying to figure out. Let me know if you can hear me. All right, so we'll just get right into it. So, nursing practice and nursing career has evolved over the ages, and now the increased complexity in healthcare and its delivery has made career growth in nursing very, very essential. Now, who should go for what? What are the options that we have in career growth? Assuming you're a nurse, you're a new nurse, you just started nursing, or you are a student nurse who is yet to complete basic nursing school, and then you're thinking of what we call progressing in your education, thinking of furthering your education, or you're thinking about, specializing. What are the areas that you can go to? What are the options that you have on the table? This live stream is purposely because of that. Once again, my name is Ness Evie. Welcome to Smart Nursing, and let us go right into it. So, if you want to progress or advance in your career pathway or in your career as a nurse, you have three main areas to concentrate on or choose from. Now, you can either go the clinical way, you can go the leadership way, or the educational way. What do I mean by that? If you want to go clinically, or you want to progress in your clinical roles, then you need to go specialize in any of the specialization areas in nursing. Now, when you're talking about specializing, we have specializations like emergency, we have oncology, we have pediatrics, we have midwifery. Now, you can go as higher as what we call the nurse practitioners. Now, this is a little tricky. When it comes to nurse practitioners or clinical nurse specialists, every country has their definition. They have their prerequisites. For example, in Ghana, we now have the highest form of nursing education at the Ghana College of Nurses and Midwives. Okay, that is the highest of nursing clinical education in Ghana as at now. Now, before you enter that college, you should have had a first degree. Okay, that qualifies you to enter into the college and pursue any of the specialty areas that might interest you. Now, in other countries, to become a clinical nurse specialist, for example, in the US, you need a minimum of a master's degree. Okay, so these terms are used, the way you use them in other countries differ. If you say a clinical nurse specialist in Ghana, it is different from a clinical nurse specialist in the US. Okay, so if you are thinking about progressing in your nursing career the clinical way, then you can specialize in any of the specialties available. We have oncology, we have emergency, we have theater nursing or perioperative nursing, we have ophthalmic nursing, we have ear, eyes, nose, and throat. There are so many specialties. You can specialize in ICU care, you can specialize in burns, anything that interests you. Now, like I said earlier, when you are about choosing a pathway to specialize in, you need to be sure of what you want. Okay, so this first topic or this first area we are talking about is just for clinicals. Those who are sure that they want to work in the clinical area, then you can go that way. Depending on your country's policies of education, depending on where you find yourself, you can choose the clinical pathway. Okay, like I said, elsewhere you will need a master's to proceed to become a clinical nurse specialist or a nurse. They call them nurse practitioners. You can have family nurse practitioners, you can have nurse practitioners in all kinds of fields. Okay, you will need a minimum of masters for that. You can go as high as becoming a doctor in nurse practice. Okay, they call them DMPs. They are prefaced with doctors, but they are not medical doctors. They are doctors of nursing practice in the clinical field. All right, so you pay attention as we go on. So for that aspect, you will need, to know the prerequisites of the school you're going to, the country you're in, and whether you qualify, and then you can apply. We will talk about what can let you know what type of specialty or what type of career pathway to choose from. Like I said, you can go the clinical way, the educational way, or the leadership way. All right, so let us talk about the leadership way. Now, leadership in nursing is more like an added advantage. Okay, I said that because you can either be a clinical person and still be in a leadership role, or you can be a, an educational person and still be in a leadership role. All right, so when you are talking about leadership, even your chargeness or you being a chargeness is a form of leadership. All right, you being a chargeness is a form of leadership. And then you can have, nurse managers, block managers, directors of nursing, chief nursing officers. Now, directors of nursing also are in levels. You can be a director at your district level, or director at your regional level, or director at your national level. Now, all these positions, when they are being advertised, they come with, a criteria. They come with things that they look out for in the in people to occupy those positions. And so if you want to go in those areas, then you need to make sure that you have all the requirements. I know of some positions here in Ghana that you will need to have a master's for. You will probably need to have even a specialty from the Ghana College if you are a nurse, in Ghana, and you will need to have some years of experience. You might have, attended or have some training, some leadership trainings, or have some diplomas or associate degree, something in leadership training. There are always requirements for that. All right, so you need to know what the requirements are for those positions and see if you meet them. Then the last aspect is about the educational, pathway. Now, for an educational pathway, if you want to be in education, then your second degree after your BSc, which is your bachelor's, has to be an MPhil. Your second degree has to be an MPhil. Now, what that means is that you will not go to the university and go and do a master's or a master of science in any of the fields. You can't go and do what we call MPH, Masters in Public Health, and then want to remain in the education field. You will not go anywhere. So you need to know your plan, know what you want. Okay, know what you want. Don't just choose courses because they are available. No. At the end of the day, you will just keep the certificates in your room and then it wouldn't go anywhere. Money is lost, time is lost. All right. So if you want to go the education way after your first degree, then you need to have masters in philosophy, right? That is MPhil. Now after your MPhil, you can go ahead and do your PhD, if you so want, and then become professors if you so want. I know nurses in Ghana right now who are professors and associate professors, and as for the PhDs, there are just a lot of them. Okay, one of the nurses who is actually a professor, it's even a vice chancellor of one of the universities in Ghana. Okay, so nurses have gone very, very, very far. Now you can even digress. You're not digressing, but you can add more knowledge from another sector into the nursing field. For example, I know nurses who are lawyers now. Nurses are politicians. Now you know that if you have people who understand your profession in key positions, pushing policy ideas or enacting policies or even implementing policies in the field becomes very easy because they understand it. They know what it means. All right, they understand what it means to be a nurse. And so when they are in key positions, imagine you have a nurse who is a president, a nurse who is actually the minister, a nurse who is a regional minister. You can just imagine nursing issues or nursing related problems will really meet, a shared understanding. All right. So nurses can go to the other aspect also. You don't really have to remain in nursing. Okay. But at the end of the day, the most important thing is that how are you able to tell what pathway you choose for? For example, I, for one, after I did my first degree, I realized that I was interested in clinical practice. And so when the opportunity came, I chose the clinical, specialist pathway. I have colleagues who I did first degree together with, and are now nursing tutors because they realize that they want to remain in education. Okay, so you need to do a self-introspection. You need to reflect on yourself. You need to reflect on yourself. Reflective practice is actually something that has come to stay. I mean, it is proven, it's tried, and it's tested. Now, even on the ward, anytime you are done with your shift, you need to sit down, look at, have a clear introspection or retrospection of what happened during the shift. What happened during the shift? What were your low points? What were your high points? What didn't you like? What did you like? What do you think you could have done better if you find out there was something you didn't like about the shift? What could you have done better about the shift? All right, you note it down. And what does that do? It helps you improve upon your practice. The next time you go on duty, you'll be able to correct all those mistakes. All right. So when you want to choose a career pathway, whether you want to go the leadership way, you want to go the clinical way, or the educational way, you need to know yourself, know your strengths, know your weaknesses, know what you're good at, know your skills, know what you are made of. All right, that helps you to identify the aspects that suit your personality. Okay, and then having mentors and network of people who inspire you. It's also very, very important. Maybe you might not know what exactly your your preferred choice would be, but there is this person who you so admire. For all you know, that might be your area. Okay, so knowing your strengths, having what do you call it, mentors, having shadows. Shadowing is like um you're walking in the shadows of someone. So there is this practice in clinical practice or residency. Like we actually did when I was doing my residency, is you shadow people. So you are scheduled on duty with somebody that you learn from. Okay, it's like a mentorship program, but that mentoring ends immediately the shift ends. Okay, it doesn't continue. All right, that is like shadowing, but you can actually extend it if you want to. You can choose to be in the shadows of that person and see if there are things that that person does that you like. All right, now by so doing, you will identify, yourself as and when you meet or as the time goes on. So mentoring, very important. Um, Following people, shadows, having the reflective practice. Okay, reflection is very, 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 very important. So, what have we been talking about? We've been talking about career advancement. Everybody is wondering, especially the new nurses who have just, you know, they have just passed their licensure exams, and then they've started working as registered nurses, new registered nurses or staff nurses, or student nurses who are actually about to complete school. They are thinking about, where do I go from here? Where next from here? You know, please make a conscious effort. Pay attention to yourself. Listen to yourself. Study yourself. Go on, any of the social media platforms, search engines, Google, Science Direct, whatever. Look for what it takes to be a clinical person. Look at the requirements for leadership. Look at the requirements for education. See if it suits you. Because at the end of the day, trust me, there wouldn't be anything, you will not have any satisfaction from what you're doing. And most importantly, you need to also look at the income. Look at the money that comes out of it. If you go and do a program and at the end of the day it has no value to you in terms of financial gain, probably you might have spent a lot of money on the program, then what have you gained? Unless, of course, it's just something you want to do, add it to your accolades or your CVs. Well, but if you're talking about career advancement, you should see some progress, you should see some difference in your money, you should see some difference in your salary. Okay, so when you are thinking about these areas also, you need to think about the money that it brings. That is very important. At the end of the day, you have families that you take care of. You have needs that you should take care of. Okay, so if the money is not enough, then it's not worth it. Okay, then you also need to look at, if you're a family person, before you choose a career pathway, look at the demand, okay, the stress level, because burnout, trust me, burnout is key. Burnout is there. Nursing is already stressful. Nursing is full of emotions, okay? There's a lot of emotional roller coaster in nursing. Now, if you're advancing and you are the type who is concerned, then you need to look at what you're choosing and if it allows some flexibility for other activities like family gatherings or religious activities, social gatherings, whatever your extracurricular activities are, or whatever you do outside your profession, you need to know whether or not this career you are going into will allow you or give you the room to be able to do that. Don't choose a career pathway that potentially will cause problems in your marriage, for example, or will cause problems in your religious activities, for example, or cause problems with you and your children, for example. Okay, so think critically about all these areas before you go ahead. All right, think critically about these areas before you decide and choose what career you want to do next from here. Because trust me, like I said, money might not be everything, but it is also very important. Okay, money might not be everything, but it is also very, very important. Without finances, without any means, there is no joy. I mean, everybody likes money. So when you want to decide, think about that also. That's not the only thing you're thinking about. That is not the only thing. You're not only thinking about whether this career or this path I am taking will bring me money. No, you're looking about the joy. You're looking about the peace of mind, because at the end of the day, it is for the betterment of your patient. It is to improve your practice. It is to improve your outcomes. That is why you need to choose something that you like. Okay, something that you have the passion for, something that you are good at. All right, so you need to do that reflection to decide on what works best for you. What works best for you. If it's necessary, you can actually ask for opinions from people. You can actually ask for opinions from people who know you, study you, and then they know that this particular nurse is good in procedures, or this particular nurse is good in, supervising others, or this particular nurse is good in teaching. Okay, then at the end of the day, you'll be able to choose what works best for you. All right. So once again, this is Smart Nursing. We'll be talking about career goals or advancement in careers for nurses. And then we've been touching on the three main areas that you can choose from. The first one being the clinical aspect, the second one being the educational aspect, and then the third being the leadership roles. Thank you very much for watching. Thank you for staying with us. We are very grateful, and then we encourage you to keep sharing our videos, like, comment on our videos, subscribe if you're a new person, so that at the end of the day we can all grow together. Well, it's actually 11:14 in Ghana. I mean, and I don't know. We all like life. We all like, nights. I'm actually a night person. I mean, the night time is where everywhere is quiet and the children are quiet and the environment is quiet, and you can actually have some quiet time and then read something. Let me tell you something, you guys, okay? Make sure you read something every day. I mean, the more you learn, the more you become knowledgeable. Nursing is changing. The trends are changing every day in, day out. There are new evidences coming up. Nursing is now evidence-based. All right, so make sure you read something every day. When you go to work, you come back from work and you encounter something, you encounter a condition, or you encounter some symptoms, something that you are not familiar with, please come back and read about it, and trust me, it will stick forever. All right, so I actually like reading in the night when everywhere is quiet. So that's just a little tip for you guys. And so I am grateful, very, very grateful for this opportunity to share some thoughts with you about this career advancement. Now, let us know in the comment section if you like this video, and also I want us to engage in this conversation about what do you think about the future of nursing. Where do you see nursing going from now? Pay attention to the turnovers, pay attention to the pandemics, pay attention to the high demand of nurses. Okay, let us have a conversation. Let's talk about the trends, all right? What do you think about nursing in the coming days or the coming, yes, in the future, all right? So like you already know, here we talk about nursing tutorials, but once in a while, we will have this one-on-one engagement where we can, have a tete-a-tete chat, share ideas, discuss issues, evolving issues concerning nurses, all right? And then we'll also have another video where we'll talk about immigration, the step-by-step process that you can follow if you want to migrate. If you're an international nurse, for example, you want to go to the Western world, be it the UK, the USA, or wherever, we will be discussing, or showing you the step-to-step approach. There are agencies there that can help you, but you can also do it by yourself, all right? And so watch out for our next video, our next live, and then this is Nurse Evie signing out. Thank you. Bye-bye. Do we have any questions though? Any questions? No questions. All right. See you in the next video.